Tammy with QuickMD, and today I'll be showing you how to do a self-injection at home. You can have someone help you with the injection if you have trouble doing it yourself. First, please wash your hands thoroughly. Then, be sure to have your materials laid out in front of you on the table. The first is your specific prescription medication. The second is your syringe. Please note the measurements on the syringe are in units and refer to your specific prescription to ensure that you draw the correct amount. Then you will have your sanitizing wipe to thoroughly disinfect the area that you will be injecting, as well as a sharps container to dispose of your needle afterward. Now we will prep the injection. First, take your needle, and please note the measurements on the needle are in units. Please refer to your specific prescription when drawing out the medication. Next, take your sanitizing wipe and wipe the top of the medication. Then take your needle and carefully remove the orange caps. Take the bottle of medication upside down and insert the needle fully and carefully draw out the number of units of your prescription. Make sure there are no air bubbles, and you may lightly tap on the medication to ensure that there are no air bubbles. Now we'll be doing the injection into the abdomen region. First, take your sanitizing wipe and thoroughly disinfect the area in which you'll be injecting. Next, take your needle and you want to pinch the skin to create a bulge and then inject into that bulge. Inject all of the medication. After injection, apply mild pressure to the injection site with a wipe. No bandage is needed on the injection site. Carefully cap your needle and then store in your sharps container. Once done, you can store the medication in the fridge, but don't put the medication in the freezer. If you have any questions, please contact your healthcare provider.